The University of Benin Teaching Hospital UBTH has unveiled a drug testing center in Benin City, becoming the first teaching hospital in the South-South geopolitical zone to establish such a facility. The Chief Medical Director, Professor Idia Izeyamu, said the center will support the prevention, early detection, and treatment of substance abuse. She said the facility can test for substances including cannabis, amphetamine, fentanyl, methadone, tramadol, ethanol, barbiturates, and benzodiazepines. The CMD warned that substance abuse could lead to impaired judgment, violence, accidents, poor academic and work performance, addiction, and loss of lives.
Substance dependence, the individual can be guided towards appropriate care and support. And this is the unique advantage of this drugs testing center in the University of Benin Teaching Hospital. We are not simply testing for drugs or alcohol, we are creating a pathway from detection to intervention. The purpose is not to stigmatize people or make assumptions about them. A test provides information. What we do with that information is what truly matters. When there is a problem, there must be help. When there is a risk, there must be intervention. And when there is an emergency, there must be a capable medical team ready to respond. The presence of the NDLEA, the Nigerian Police Force, the Judiciary, the Nigerian Army, the Nigerian Immigration Service, even youth representatives, Police Officers' Wives Association, Nigerian Customs Service, they are all stakeholders, and they remind us that substance abuse is not only a healthcare issue. It's a public health issue, a safety issue, a social issue, and ultimately a human issue.
The Assistant Inspector General of Police Zone 5, Mr. Monde Agbonika, said the police would ensure proper drug testing and investigation before suspects are charged to court.
Adducing relevant evidence, I'm happy that the criminal justice system is almost complete here because we don't have the corrections here. So, but we have the police, we have the judiciary, problems with the criminal justice system when it comes to handling of cases like this. Well, we make the arrest, we do the investigation, and then we arraign before the appropriate courts before action is taken. And before any of this can take place, we must have proper testing, because that is the evidence that we decide that we can use to say that this person was under the influence of alcohol. We need the scientific evidence.
Other stakeholders, including the NDLEA, Judiciary, and Edo State government, called for stronger collaboration in tackling substance abuse, particularly among youth.
Gone are the days where your children will now be telling you, oh, Mom, I don't do drugs. Dad, I don't do drugs. With technology, we have made it possible to subject every individual to a drug test. And if you smoke cigarette, for example, nicotine shows. If you take tramadol, it shows. If you take codeine cough syrup or any of the commonly abused substances, it will just indicate in a few seconds. Now, what is the objective of this study? Number one, to create awareness, because people must know that there is drug testing. They should know that we have a center here at UBTH. Number two, we must identify the risk involved in not testing. Number three, screening justification. Number four, we must promote policy. And most importantly, number five, we need a collective action.
Before I came into this stream, we've had laws that try to ensure safety of our environment. But don't forget, when you talk about illicit drugs and all that, it's on the exclusive list, so NDLA is there. That was why I said just then that every attempt to fight the menace of illicit drug distribution is just to see how we can bring it to the minimum. But whoever we arrest, at the end we send them back to NDLA for prosecution because they have the prosecutorial power. So, however, the state frowns at drug dealers because without drugs, you cannot kidnap. You cannot do armed robbery. You cannot even drive in this one way as low as it is. Something must be wrong with you. To see somebody driving opposite you and it's on the right side of the road and you decide to face the person. But above all, if we are talking about safety and security, we must deal decisively with drug distribution.
high point of the event was the commissioning of the Drug Testing Center by AIG Zone 5, Monday, Agbonikon. CD Benevolent reporting for CNT News.